pharmacist or anything. What about parents that don't do the medication on the weekends or the long holidays, or as far as how a child, like, yay, you don't have to be on the medication, or as far as a school setting, parents are always like, well, he doesn't take medication on the weekends with me, so excuse the behavior on Mondays.
Okay, so for, again, emphasizing, not a physician. I'm trying to be as ethical as possible. So what I know about that is that's very common. Kids don't take their medication in the summer. From a pharmacological standpoint, stimulants are not like antidepressants or any SSRIs and SNRIs where you need to let them build up in your system for 4 to 6 weeks for them to start working. So they're kind of immediate. They're almost like a benzodiazepine. The medication is immediate, okay? So pharmacologically, it doesn't change the way the medication works. Their behavior shouldn't be any different on Monday, though, if they take their medication. However, coming from a treatment perspective, I think it's best to keep it consistent because if you're feeling differently on the weekends, we're trying to globally change a behavior. So if on the weekdays I'm able to comport my behavior and do well and earn tokens, and then the weekends it's just like willy-nilly, it's not very consistent. So I personally wouldn't encourage the breaks. Does that make sense? Yes.
So talking about consistency, would you encourage that parents adopt the same tokens that the school is adopting with reinforcing positive behaviors, or vice versa, that the teacher be willing to accept the kind of system the parent might have in place, which might be complicated?
Yeah, it would have to be more open communication with that. So I'm not sure. Do you have a particular token economy system in mind in terms of the classroom?
Well, just like you kind of alluded to the system where the child has an opportunity that if they walk in and started on, level 0, and they're just going to throw up their hands and say, well, I'll just be bad the rest of the day.
Right.
Kind of that opportunity for them to
improve.
Whereas at home it's very cut and dry. You do this, or you know.
So what I've done to kind of bridge that gap in the past is maybe we can put one of our target behaviors as being on green at the end of the school day. So we'll reinforce that in our home token economy system, and that's kind of like an inception of a token economy since it's already its own thing. Does that make sense? So maybe one of our target behaviors is sitting still for dinner for 15 minutes, and one of our target behaviors is going home with green for good from school. But I think it is helpful to, if the teacher is willing to work with a parent on, certain behaviors, if they want to have like a specific school token economy as well, where they, earn a bookmark or something, or 5 minutes of recess, who knows, that could be something that's helpful as well. But again, because classrooms are so full, trying to come up with a system that is equal for all kids.
If a token is failed to be earned by the child, can you speak to what the parent should be doing in that situation? Like, I imagine that this child's starting to throw a temper tantrum because now they failed to get the token.
Okay. Yes. So we want to have our target behaviors. We want something that's pretty easy to get. We want one that's moderate, and we want one that's maybe a little bit harder.
Make it through dinner, sit in for 15 minutes.
Okay. So if they're not making it through 15 minutes, let's maybe readjust that goal to 5. We're hoping if they're at the 15-minute mark that they've been successful with 5. If not, and things result in a temper tantrum, anyone know what to do if your child's just crying on the floor and they're not listening, they're not hurting themselves, they're just crying? You just ignore them, yeah. You just walk over them, go to the kitchen, get your mom juice. You want that behavior to extinguish itself. And so classical extinction says when we stop reinforcing that, if I sit down here and I say, why are you crying? I say, we're going to your room and I'm taking this kid upstairs, now I'm giving them my attention. So as soon as that child stops crying, I'm going to find something to say. I loved how you just got yourself up off the floor. That's so wonderful. I'm going to, praise something positive. So we're going to ignore it, and we're going to wait for that minute that we can say anything remotely positive. Okay.
What advice do you have for us dealing with or trying to advise parents who are maybe have a child who's on the high end of the spectrum, whether inattentive or hyperactive or both, but who are adamantly opposed to medication?
Behavior modification. It works. It's, a lot of parents are opposed to medication, and that's their right. And, as a therapist or as a clinician or as a teacher, at the end of the day, we need to respect what our parents' wishes are. So coming up with something that maybe is a little more stringent, or I think I'm doing all the evaluations right now at San Antonio Counseling. And one of the things that really just makes me sad is the lack of organized activities that children are involved in, sports. The only time I can ever get them to sit still is when they're on the iPad. So they're on the iPad 5 hours a day. So if someone's really hyperactive and impulsive and they just spent 5 hours on an iPad, what do you think where's that energy going? It's going to be worse. So I would recommend kind of putting them into some sort of activity. It doesn't have to be sports. It can be chess club. It can be whatever. It gets them involved with other kids, and that helps, again, build that confidence, build those social skills. They see, look at all of these children are acting differently than me. I'm going to try to model that behavior. This seems to be working really well. So again, especially if they're higher functioning and they're able to comport that behavior a little bit better, working on it, making it just very individualized for that person and trying to get them involved in things that they're interested in. Because at the end of the day, if I'm not really interested in anything else, why would I work towards that, So making sure they're a big part of that planning process. Yes?
Just want to maybe it'll help. Region 20 is actually doing a parent training October 7th on Love and Logic.
Awesome.
So it's going to be available in April as well, but I think it's October 7th, the Love and Logic.
Love and Logic? Yeah.
At Region 20?
There's a book I recommend to almost every parent I see. It's called SOS Help for Children by Dr. Lynn Clark. It's just a simplified, written in layman's terms, basic behavioral principles. We're talking classical operant conditioning. But it's written for parents, and it's a great book. It's $5 from Amazon. So it's kind of okay, you learn all these things in session. How do you relay this information? Because as soon as you walk out of my office, you might forget. So it's a good reminder to have. Some additional information, handouts if you are a therapist and you're doing parent education, giving them resources to take home with them so that they can generalize that information.
Kind of going back to what do you say to tips or trends for those that aren't on medication, they're in maybe some sports or whatever, but then they're all in the same town because of that?
Yeah, that's really unfortunate. I would try to talk with the coach or try to find a different program. I don't know much. I just moved to San Antonio, so I don't know much about the community resources, and I don't know if there's any social workers here or any counselors that know more about resources that are available for kids that struggle with things like that.
There's Connecticut's, but that
Connecticut's. Yeah, so if there's some sort of program, or if we could start a program where you don't kick kids out because they have mental illness, would be really wonderful. Yeah, looking for other things that they enjoy doing. It's, sitting down and asking your child, what do you like to do? What do you like to do for fun? Do you like to ride your bike? Do you like to go to the park? Do you like to run outside? finding things that they like to do and then structuring your time that you spend with them around that, I think is really important. Anything else? Yes, ma'am.
For teenagers who might not respond as well to stickers and that kind of thing, you just pay them real money.
Well, I'm a big fan of early intervention, so I'd like to throw that out there to start with. That's a good question. I mean, you'd think that they're not, right? You would think that. But this works on adults all the time. And it might not have to be stickers, it could be, I guess I don't want to put it as money, but do you have a recommendation?
Yeah, I was going to say, because I do work with a lot of teenagers and the parents, I do kind of recommend the money sometimes if they can afford it, like $1 a day, 50 cents a day, whatever they can afford, because they do like to buy stuff. But also privileges. You give input. You want to go to the dance. You want to go to the football game. You have to do this, and that. Your behavior.
Yeah.
So privileges work good. Also with special money.
I've done once with a teenager. We got a puzzle that was blank, and she was very artistic. So she drew what she was working toward, and then she got puzzle pieces. And as she was working toward it, she was putting the puzzle together. So it was kind of creative, and she was very artsy, and she really seemed to enjoy that. Yes.
Dr. Gary Chapman has a book called 5 Love Languages, and there's one out for teens as well. And what I have found surprising, or not surprisingly, is that many teenagers value things that don't cost money, just time. So in that respect, it would be to find out, I would want to find out, well, what is the teenager's love language? And then frame the reward around what they're interested in. Maybe it's a hike or a drive to, a wilderness park nearby, and just to spend that time, which, there's value in time as well. So it may not necessarily just be something like a token.
Yeah, exactly. So important to have the patient, your child, your student involved in the rewards making system, and what are they working toward. Yes.
I was just going to suggest most of our teenagers have electronics and stuff. We always, like, when we're working with our parents at our campus, one of the things we tell them is that they've got luxuries. You're supplying them with iPhones and straightening irons and nails getting done, and all of those cost money. They don't come. They
Right.
fall out of the tree. So those can be easily turned into a token of money, or you have to work toward
Right.
that salon visit, or you have to work toward that Xbox time.
Yeah, I think that's a great point, that a lot of times parents will automatically have all these privileges to their kids, and then instead of reinforcing, they're punishing, so they take away the privileges. So kind of flip-flopping again, positively stating. So now I'm working toward rewards versus being punished and getting things taken away. So, maybe I'm working toward Xbox time, and I can use that whenever I want it. Or I'm working toward a salon visit. What a lucky kid. So yeah, working towards something instead of just automatically having these privileges and then taking them away, not going to change behavior as well as someone who's working towards something.
Thank you.
Thank you.